But first, it is a story that surprised so many people. Football star and the man in what was called the trial of the century, O.J. Simpson, died after battling prostate cancer.
We got that big news yesterday. The younger son of late civil rights leader Martin Luther King Jr., Dexter Scott King, also lost his battle with the disease earlier this year. Here to talk about this, we welcome our 9 News health expert, Dr. Pio Coley. Thank you for joining us this morning.
Thank you, ladies.
Thank you so much. I think this is top of mind for a lot of people right now. And so for people who are thinking about prostate cancer and screening, what is your starting point? What do you tell them?
Well, you know, prostate cancer is one of those tricky cancers. For the longest time, we thought it was an indolent or slow-growing cancer. We don't have to worry as much about it. But more recent data is now telling us that prostate cancer lives as it is born. So most people will get a very slow-growing cancer that just kind of hangs out in the prostate, and they probably won't die from it, but they'll kind of die with it. But there's a subset of men who get this aggressive prostate cancer, which actually spreads very quickly to the bones, the lymph nodes, the lungs, and that's really how you can die from it. But catching it early, whether it's high risk or not, makes the huge difference.
And leading into our next question, how are we screening for this? What are maybe some signs we might see?
So usually you won't see many signs. I mean, obviously the prostate gland, you know, is a little gland that sits kind of in the reproductive organs. It's a tiny little walnut-sized gland. And the cancer appears as little knots of tissue. So you're not going to feel anything. So really you have to go looking for it. And the guidelines say you should start looking around the age of 45 if you're average risk. But if you're African American or you have other risk factors, genetic mutations, or family members who've had aggressive prostate cancer, you may want to start as early as 40. And it's pretty simple screening. It just entails usually a blood test called the prostate-specific antigen, which is a little blood test, a marker that comes from the prostate. Now, that can be non-specifically elevated during infections or if you have just enlargement of the prostate. But that combined with what's called a digital rectal exam, where the doctor actually puts their finger into the rectum, feels for any masses, and possibly imaging like MRIs can really help to screen.
You touched on this, but it sounds like there are certain groups of communities and men that are at a higher risk for this.
Very much so. And the African American community is 1.7 times more likely to get diagnosed and 2.1 times more likely to die from prostate cancer than white men. And this is a huge problem. I mean, this racial disparity has persisted. So black men get diagnosed early. They get diagnosed with more aggressive forms. So they get diagnosed earlier in life and the cancer tends to be more aggressive. And there's a bigger delay between diagnosis and treatment. Now, there's many factors for this. You know, some of this is cultural. There's a mistrust of the system. Some of this is we don't have black men in our clinical trials for prostate cancer. So we don't know if the disease is different in black men than it is in white men. But really, it's a problem that's persisted, which is why we put a target sign on black men when it comes to prostate cancer to really start looking for it earlier.
You touched on the screening and maybe earlier being that 40 mark. Should it be even earlier for a black man?
You know, possible. I would say 40 is kind of where most black men should start. But if you've had a family member who had prostate cancer early, you may want to talk to your doctor about your individual risk. And there's actually a study that came out of Europe that got a lot of attention where PSA is what we've used as the workhorse of screening, right? This blood test. But if the cancer is small enough that it's not popping open the prostate cells, releasing PSA, then imaging might be a better place to start as well. So talking about the combination of blood tests and imaging to screen some of these higher risk populations is where that paradigm for prostate cancer screening is going.
Yeah, well, thank you so much for coming by. It's such critical information, especially as people are talking about it right now. So we really appreciate you stopping by.
Thank you.